Welcome to E3 Rehab. We're going to bust 3 plantar fasciitis myths in 3 minutes on this Monday. Set the timer, let's do it. Myth number 1, inflammation. It's in the name, plantar fasciitis. Itis, the suffix, implies inflammation. However, Lamont et al. In 2003 took samples of this tissue from individuals who underwent surgery and found no evidence of inflammation when they examined it under a microscope. Does this mean that inflammation is never present in this condition? No, not necessarily, but it likely isn't the primary driving factor that underlies plantar fasciitis. And therefore, a more suitable name is simply plantar heel pain, as noted by Henrik Rial and colleagues in 2017. So, should you use ice? Sure, if it feels good, but think about it providing short-term relief rather than being a long-term solution. Additionally, complete rest isn't the answer. The goal is about finding a tolerable level of activity for you, kind of that Goldilocks principle, and building up over time. Myth number 2, heel spurs. It is not uncommon for individuals experiencing heel pain to receive imaging, often in the form of an x-ray. Now, an x-ray can absolutely be warranted if there is a suspicion of a fracture or a bony stress injury, but for this diagnosis, commonly referred to as plantar fasciitis, it is not helpful at all. You get an x-ray, you see this heel spur, and then you think, what can possibly be done about this other than surgery? It's true. No amount of rest, physical therapy, or other forms of rehab are going to get rid of that heel spur. Essentially, it takes away your self-efficacy because there's nothing you can do about it. But the heel spur doesn't actually matter. Hansen et al. In 2018 followed 174 patients diagnosed with plantar fasciitis for 5 to 15 years and found that heel spurs had no bearing on long-term outcomes. Menz and colleagues in 2008 also found that if anything, these heel spurs are simply more common as we age, kind of like gray hair, and in obese individuals. Myth number 3, breaking up scar tissue. This one might come as a surprise as it is a fairly common narrative, but we can't actually break up scar tissue or adhesions with massage, foam rolling, or using a lacrosse ball. Chaudhry et al. In 2008 determined that it would take 1,800 pounds to compress the plantar fascia by 1%. Imagine trying to apply that kind of pressure to the bottom of the foot. It's just not possible. You need to run over it with a tank just to compress it a few percentage points. Does that mean these interventions are completely useless? Not necessarily. They can feel good and provide short-term relief, but they are not the answer as often touted and would need to be paired with more active strategies, which I'll discuss in the next plantar fasciitis video. Whew, I think I did it. Thank you so much for watching. If you want to know more about plantar fasciitis or this plantar heel pain, head over to our website, e3rehab.com, or check out the links in the description. We have a blog with over 30 scientific references. We have a podcast with Henrik Rial, who is one of the leading experts on the topic, and we have a 12-week program designed specifically for this condition. If you like the video, please give it a thumbs up, subscribe, comment below on what other topics you want us to cover next time. Peace.